Good afternoon, everyone. Welcome to this wonderful event, Show Your Lungs Some Health, and recognition of the American Cancer Society's The Great American Smokeout. My name is Dr. Phoenix Matthews, and I am a professor at the University of Illinois at Chicago in the College of Nursing. I have a long history in smoking cessation research and more recently associated with lung health that's related to lung cancer. So increasing awareness and engagement in lung cancer screening. So I'm happy to share with you this very, very dynamic panel who will be sharing with you some of their experiences as clinicians working with lung cancer screening, as clinicians who are working with smoking cessations, and as a cancer survivor and an individual who has been able to successfully stop smoking. Before we get started, I would like to share with you just a little bit of background to get us started and grounded in the area that we'll be talking about. The next thing is that I'll have each of our panelists briefly introduce themselves, and then we'll go about having a question and answers session that's also inclusive of some of the wonderful questions that some of you had submitted. So let me get started with providing a little overview and background. Okay, so we're here to talk about lung health, and one of the primary issues that we're concerned about when we think about lung health is lung cancer specifically. Lung cancer accounts for 25% of all cancer-related deaths. So even though it's not one of the most frequently diagnosed, it's one of the most deadly cancers that individuals can experience. When we think about survival from cancer, we know that with early detection, breast, cervical, and colorectal cancers have extremely high 5-year survival rates. That means what the percentage of people who are alive 5 years after a cancer diagnosis. For breast, cervical, and colorectals, those are upwards of 80%, 90% in some cases, but we see that our 5-year survival rates for lung cancer are significantly lower than that at 26%. So again, it tells us the important work that is required to increase early detection and screening in this area. As you can see, from the slide here, we have screening information about lung cancer screening from different regions around the country. And as you can see, rates of lung cancer screening are very, very low. The Northeast has some of the highest rates, but that's only 10% of eligible individuals who have been screened for lung cancer early detection. So we have work to do there. So what's the primary cause of lung cancer? The most common cause of lung cancer, affecting 80 to 90% of lung cancer, is due to a history of chronic high-frequency smoking. So smoking is... Yes?
Sorry for the interruption, but we can't see your slides.
Oh, you cannot? There we go. How about now?
Yes.
Okay, so just brief highlights. So lung cancer accounts for 25% of all cancer deaths. The 5-year survival rate is relatively low compared to the other screenable cancers. And we know that smoking is the leading preventable cause of lung cancer. Smoking is so strongly associated with lung cancer, over the past 50 plus years, there have been a lot of public health initiatives that have been aimed at reducing tobacco rates, smoking rates in the country. You can see that in 1965, when the Surgeon General first put out the report that definitively linked smoking with lung cancer, smoking rates in the general population were about 42%. So nearly half of US adults were smokers in the mid-60s. Due to public policy and education and prevention campaigns, we now see a much lower percentage of smoking in the adult and adolescent population at around 14%. And that is terrific news, but we still are working very much to reduce that rate, smoking rate even lower. Despite national averages that have improved significantly, about 14%, we do see that there are geographical differences in smoking rates, as well as racial ethnic differences in smoking rate. So here are some local data from Chicago. In Chicago, just under 17% of all adults are current smokers. Again, much better than what we were seeing in the mid-60s, but higher than the national averages. But when we look at the city as a whole, we miss a real important picture that we can see big differences based on race, ethnicity. White, non-Hispanic whites in Chicago smoke around 15%. But look at the rates among African Americans. Blacks, adults in this population in Chicago, about 25% of Black adults smoke in Chicago. And again, you'll see that that's much higher than the national average for Blacks across the country, which is concerning for us here in Chicago. So tobacco, not only does smoking contribute to lung health issues such as lung cancer and COPD, but it's also a major contributing cause to other types of premature deaths, including heart disease, cancers, other types of cancers, as well as stroke. And when it comes to lung health, we see that African-American or Black men have the worst health outcomes associated with smoking compared to men from other racial ethnic groups. So smoking has a negative impact on the health of all individuals, but there does seem to be something that's happening among Black men that increases the negative outcomes associated with smoking. Lung cancer screening has been shown to be, with low-dose CT, lung cancer screening has been shown to be highly effective in reducing lung cancer-related deaths by about 20%. There was a large study that was conducted in 2011 called the National Lung Screening Trial. And in that trial, results of that trial were able to demonstrate that screening through low-dose CT among high-risk, high-frequency smokers contributed to improved survival due to early detection. Since that time, insurance coverages have begun paying for the reimbursement of lung cancer screening, and so guidelines have been established for that and are currently in place. So what are the guidelines for lung cancer screening? So they've been changed recently. So the new U.S. Preventative Services Task Force guidelines are associated with age, 50 to 80, pack years of 20 plus pack years. That means you have smoked at least a pack a day for over 20 years, or that you're a current or former smoker. So those are some of the guidelines. There are barriers that we observe in terms of lung cancer screening, and those are at the provider level, lack of knowledge about among some of our providers about lung cancer screening, time constraints in the clinic as a part of the clinical practice time that's allowed, and then patient level barriers such as fear, lack of knowledge, and negative attitudes. So action is needed now to improve lung health. And what we'd like to do is to introduce our panel and start to talk about some of the issues that are associated with increasing knowledge, access, and information about lung cancer screening, but also, more importantly, focusing on reducing the primary risk factor, and that is smoking. So can I ask each of our panelists to briefly introduce themselves, and we can start our discussion. Let's start with Debra Blum. Debra, can you give us a brief introduction?
Yes.
Oh, Debra, you're now on mute. There you go.
I'm a cancer survivor.
Great. When were you diagnosed with cancer?
I think it was 2017.
Okay. And where are you now in your treatment process?
I'm getting CT scans every 6 months.
Wonderful. We look forward to learning a little bit more about your journey. Hello, Jonathan Mason. Can you please introduce yourself?
Hi, everyone. Yeah, my name is Jonathan Mason. I'm a former smoker, and I became an advocate for for non-smokers since 2019. That's
Great.
when I stopped smoking.
Wonderful. And Dr. Pasquinelli. You're on mute.
Hi, I'm Dr. Pasquinelli. I'm a nurse practitioner at the University of Illinois, Chicago. I established the lung cancer screening program here at UIC. I see patients that are getting screened for lung cancer in the pulmonary clinic that have abnormal screens and in the lung cancer clinic. So I see patients throughout the continuum of care from screening through survivorship. I am also a certified tobacco treatment specialist.
And Dr. Christina Wells.
Good afternoon, everyone. I'm a family medicine physician at the Miles Square Health Center. And so I see people who come in who are smokers. I treat them and sometimes refer them to see different specialists throughout the organization.
Okay, wonderful. So the first question that I'd like to ask, Dr. Pasquinelli, we know that smoking is the leading contributing cause of lung cancer. How does smoking lead to lung cancer? On mute?
That. So smoking is a leading cause of lung cancer, but anybody with lungs can get lung cancer. It's not just related to smoking, but smoking increases the risk of lung cancer just because with you smoking cigarettes, you are inhaling a lot of chemicals. Often they are carcinogenic and they cause inflammation in your lungs that leads to changes in your lungs and can lead to lung cancer. Not all patients that smoke get lung cancer, but it does increase your risk.
Great, thank you. Jonathan, as an advocate for smoking cessation, tell us a little bit, how long did you smoke and what motivated you to stop smoking?
I was smoking since I was about 18, so about 12 years. Mm-hmm. And what the motivating factor I had was my kids, their health, and I kind of wanted to be like a role model for the people around me, because it wasn't, everybody smokes, they like, I don't smoke anymore. So they like, you don't smoke. And it's like, why? So I kind of wanted to be the face and just kind of wanted to be a motivating factor for my family, because I have people who still smoke in my family and some who don't because of it.
Great, wonderful. Thank you for your leadership. Dr. Wells, we have a lot of folks in our communities that smoke. What are some of the services and resources that are available for individuals who are interested in stop smoking?
Well, there are different things that we can offer people. We can offer them nicotine replacement. And so those include things such as patches, gum, lozenges, even inhalers that people can try. There's also, we can offer them things such as cognitive behavioral therapy. So that I've actually been referring several of my patients because we not only do you have to worry about the nicotine part of it, but also that part that, understanding, why do I smoke? What are my triggers? How do I overcome those triggers? And how do I replace them in positive ways? I find that patients who take just nicotine products, but they're not focusing on the why and the how to do something different, that it tends to be a little bit of more challenging process for them. So we offer those comprehensive resources so that they can really figure out strategies to help them stop smoking and to then deal with those triggers that are gonna always come for the rest of their lives, as we all have different type of triggers as well. So that's something that we offer.
Dr. Wells, why is it so hard to stop smoking?
why is it so hard to stop smoking? You know, there are a couple of things, because I was telling a patient earlier today, you know, one is that when people smoke, they feel good, they feel better. I mean, it really does make them feel a certain way. And so people like that certain thing that they're doing, and it helps relieve the stressor or the tension, or for whatever reason they're smoking, it helps with that. And so it's not that it's not giving them any perceived benefit. It's just that doing that thing has those long-term consequences that are negative. And so helping them to see, how can you get this similar perceived benefit from something that is more positive and doesn't have long-term negative consequences?
Thank you for that. Dr. Pasquinelli, as a smoking cessation expert, we often hear people have concerns about nicotine replacement and other stop smoking medications. What would you say to patients or individuals who would like to quit but have concerns about smoking cessation medications?
So the first thing I would do is really understand what are their concerns. And there are a lot of false information about smoking cessation aids and medications to help them stop smoking. So understanding why they are concerned about using a certain product. And then also I use motivational interviewing to understand their relationship with the cigarette and what is the best for them. We know when we partner counseling with the smoking cessation aid, be that combination nicotine replacement, or a medication like Chantix, will increase that patient's success with quitting smoking. So it's really understanding everybody has their own relationship with that cigarette, and everybody has their own, it brings their own kind of information that they have learned over the years. And some of that information is correct and some of it is not correct. So understanding the myths around it, and then how to properly use it. A lot of times people will use something and says it didn't work, but it may be because they were underdosed, or it may be because they didn't use it long enough. So really kind of looking what their experience around using a product to help them stop smoking. Because we know partnering those together, the counseling and the smoking cessation aid, can really improve our quit rates.
Are they safe?
They are safe. They are very, very safe. There's different things I look at before I choose one, such as if I have a nicotine patch. Some people have irritation skin that may be more sensitive, so I may want to stay away from the patch and do a gum or a lozenge. Some people may have teeth issues, so I may not want to do the gum, but do a lozenge or inhaler. So it is safe. What the nicotine replacement does is the cigarette gives you 8,000 chemicals, many of them that are carcinogenic, and nicotine. The nicotine replacement gives you just the clean nicotine. So you're getting the nicotine that a lot of times a patient will crave. Your brain actually loves nicotine. So we give your body the nicotine, as we don't give all the chemicals that are really bad for your body, as we then trend you down or decrease the dose of nicotine in order to help you be a successful person that had formerly smoked.
Great. So Jonathan, I know that you're a former smoker. Deborah, I'm not sure about with you, but did either of you use any stop smoking medications to help you?
I did. I was a former smoker, and Dr. Wells, she referred me to the program. It was actually Freedom from Smoking. They had a 7-week program. I used that plus the patches, and that got me smoke free.
Okay. How about you, Deborah? Did you use any, were you a former smoker?
Yes, I was a former smoker. And I always am so grateful and have to thank Dr. Pasquinelli, because it was her dissertation that I got the screening from being a previous smoker, because I quit smoking like 12 years when I had my first CT scan. And I quit by using Chantix. I tried patches, I tried a whole bunch of other things. And when I did Chantix, I quit. And then my son said, Mom, if you quit, I'm gonna get Chantix too. And he quit smoking also using Chantix.
Yes. So we've heard now 2 examples of individuals who are influencing the smokers around them by their own behavior change. So that's terrific. And it's wonderful that you have those experiences. I'm going to change the direction just a little bit. We know that lung cancer early detection screening can have a very, very positive, as we see with Debra, very, very positive outcome in terms of our overall health. So I wanted to start with providing some more information about lung cancer screening. Either Dr. Wells or Dr. Pasquinelli, can you tell and describe for us what is low-dose CT lung cancer screening? What is it? What's all involved with that?
Dr. Wells, do you want me to take this one? Okay. So lung cancer screening by low-dose CT is an annual screen. You first talk to your doctor to see if you meet the eligibility criteria. As Dr. Matthews already talked about that, it is now age 50 to 80 with a 20-pack year history of smoking, which means you smoke the equivalent of 1 pack a day for 20 years or half a pack a day for 40 years, and you have quit within the last 15 years. It is easy, quick, and painless. You go over to, we have one at the hospital. It's a CT scan. You lay down on the CT scanner. You hold your breath for 1 breath. It takes about 15 seconds and you're done. Then the imaging of the CT goes to your provider or to me or whoever in the lung cancer screening program. And we look at that and we see if there's early stages of lung cancer. Most of the patients will have a negative screen and then they come back for their annual screen. It's like a mammogram for women. They get a mammogram every year. And the goal is to find cancer early when it's most curable. And we have found in our programs and programs across the United States, as the big study that Dr. Matthews was talking to, found that catching lung cancer early significantly improves survival benefits. And Debra Blum is one of our examples of that. She got screened, found a very small early stage lung cancer. It was removed and she is doing great. And I love seeing her when she comes back for her screens because it's always good news. And it's just a way to say that it can be extremely successful. In the program at UIC, over like 65% of our patients that get their first screen are, if they're diagnosed with lung cancer, it's at a very early treatable stage. And then patients that come back for annual screen, that number even goes higher, that with more patients being diagnosed at an earlier stage. Because we know if before screening, the reason why lung cancer is so deadly is by the time you have symptoms, you usually present at a late stage, and that's what we are changing. And lung cancer screening is that very valuable tool that is able to help us with detecting cancer early.
Great. Debra, tell us about your experience with getting your first low-dose CT lung cancer screen. Did it hurt?
Not at all. It's not invasive at all. As she said, you just lay there and you go in 3 times, you hold your breath, and that's it.
Yeah.
And my first one, as soon as I got home, my phone was ringing and my doctor called me and it was like, they found a spot on your right lung. And so it was just immediate. And she was in California at a conference.
Okay.
So it was just great having the diagnosis so early and just having surgery and then being cancer-free.
Okay. So then after your screening, you were you went for surgery. What happened next?
Okay, so the doctor called me as soon as I got home from the CT scan, telling me I had the dot, and the first step was to visit the lung doctor. So I went to the lung doctor and then I went to the surgeon and we set up surgery. And I went in and I had surgery and, you know, afterwards, I remember when I coughed and it really hurt and they gave me a teddy bear for that. I was in the hospital for 3 or 4 days. I don't recall what. And that was it. And it was a recuperation time. And then I started seeing Dr. Pasquinelli, you know, we've been seeing each other for 3 or 4 years now. And at first it was doing CT scans every 6 months. And I was excited when it turned to every 3 months. And that's where I'm at now.
Wonderful. So we know from one of the slides that I presented that fear and anxiety is one of the things that can keep many people from going in for screening. Deborah, based on your experience, what would you tell people who are having some of these same fears and anxieties?
Well, I just don't understand it because the whole trick is getting an early diagnosis and not have, having cancer, not going through chemo and everything. It's just so beneficial. People who are so concerned about taking Chantix and they don't want to take drugs, but you're smoking and you're getting those chemicals in you. So I never understand that. And, I thought quitting smoking was one of my best achievements ever. And then getting cancer and then getting the early detection is just so beneficial. If I didn't have that, by the time the symptoms come and going through chemo and everything, your chances, for surviving are so lessened. So getting the early screening is so positive.
Thank you for that. Dr. Wells, if I'm a person who has either a current smoker or have a history of smoking, and I come to you for an appointment and say, am I eligible for lung cancer screening? How do you determine that? And what are the steps for linking a person to determining eligibility and linking them to services?
Yeah, I'll step back a little bit from that before I get to that. And one of the things that we do in our clinic that I think is awesome is that we actually just do a smoking screening at least yearly and every time we have a new patient. And so that gives us an opportunity, which is why it's important to follow up with your PCP regularly. That gives us an opportunity to assess where you are with your smoking, and if you need some assistance before we even get to the point of needing to, have to refer for something like a low dose CT. As Dr. Pasquinelli mentioned, and I think, actually, as you mentioned earlier, Dr. Matthews, is that, the screening guidelines have changed. So when someone comes in, we do that assessment, of their, how much they're smoking and how long they've been smoking. Also, if they're having these sort of like physical symptoms or anything else that's going on related to that. And then what we'll do is do an assessment to see, do they fit the criteria to be able to get a low dose CT. Then once we do that, then there's some, shared decision making, talking to them about the procedure, getting their thoughts about it, trying to alleviate any concerns about what the test will and will not do, the risk and benefits, right? And really, engaging the patient in a partnership and a shared decision making to say, is this the best thing? And is this the best time for this? And then once that's done, then I refer them to people like Dr. Pasquinelli, and then they basically take over from there.
Now, you mentioned something new that we haven't heard, shared decision making. What is that, and how does that factor into lung cancer screening?
I mean, that shared decision making really is that partnership, right? It goes from the, this is what you need to do and this is what you need to do right now, versus this is the, let's really think about the risk. Let's think about the benefits. Let's weigh those. Let's get your thoughts and your engagement in this process as well. Because if we're not engaging the patient in the process, then it may seem more fearful. It may seem, more daunting for them to want to engage in it. So it's really that patient-centered care. It's really pulling the patient in, making sure that this is a partnership. This is not just me telling you need to do this, but this is us deciding and weighing together the benefits and the risk, and then coming together and making this decision together.
Okay. That's great. And I know that there are some online tools for helping to inform smokers about shared decision-making about lung cancer screening and reviewing some of the eligibility. Does anyone who's on the panel have any recommendations for a good site if a person wanted to go and look something up for themselves?
I have two sites that I like a lot. One is the American Lung Association that has a great site and has videos. One is, there's a site called Should I Get Screened? I think it's called. I'll put it in the chat. And then the Go-To Foundation also has a short video on lung cancer screening that kind of goes over the whole process to give the patient more information, the individuals more information about getting screened. I'm going to put those in the chat.
Thank you. Dr. Wells, you have any additional resources you'd like to recommend? Or anyone else on the panel?
So,
okay, great. So Dr. Pasquinelli will put those in the chat box for us. We also have Longevity Foundation, which has a lot of wonderful resources, and including resources that are great because they're written at a level that most of us can better understand. Sometimes when we look online for materials, the reading level is so difficult. There's a lot of medical terms and other kind of terminology words that we're not familiar with. And Longevity has really done a wonderful job of having those really be, what the term was described before, sort of patient-centered or person-centered, and really aimed at providing valuable resources and information. So, support. I'm trained as a clinical psychologist, and I have done work in around smoking cessation, as well as working in healthcare settings with individuals who have been diagnosed with cancer. And as a therapist, I know a great deal about the importance of support, but I often hear from smokers, oh, I don't need to go to any support groups. I don't need anybody's help. I'm going to just do this cold turkey. All you need is a little grit and determination, and you can do this. And I also hear people who are diagnosed with cancer, have a cancer diagnosis, who say, I'm not going to go into any support groups. You know, I'm not really going to talk to anyone about this. I can handle this all on my own. So let's talk about the need for support and where individuals can find support for smoking cessation, for support for going in and getting screening, and for cancer support in general. So Jonathan, let's start with you. What type of supports did you need when you were quitting, and where were some of the places that you were able to find it?
Well, it was at home. That was the first step. My family, I think we all agreed, like, yeah, you need to stop smoking. And then my mom and my dad. And I actually, Dr. Wells, Dr. Wells, you know, her being my primary care at the time, she actually referred me to the program. And that plus, and when I went to the 7-week program, it actually were two other guys there, and we did the program together. So that really helped the environment. It was very motivational.
What type of things did your family members do that you found very supportive when you were?
They stopped buying me cigarettes. Yeah, that was. They stopped giving me the money to do it. That was the first step, and I think I have a lot of non-smokers around me, you know, and I kind of surround myself with non-smokers. I try to, you know, you can't pick your friends, but if you can. You know, and I have different hobbies that I do. So like running, I exercise a lot more actually. That's one thing that I actually switched with smoking, you know, so now I work out. I'm avid. As soon as I get up in the morning, when I was taking the hit of cigarettes, I do like 20 push-ups. So, you know, that's been a great.
Yeah. Now, a lot of people want to help the smoker in their life, but what are some of the things that are completely not helpful? So end up not being very supportive when you're trying to quit?
Well, being around other smokers, smoking around, if you know a person is trying to stop smoking, if you are a smoker, don't smoke around them. Try to go smoke on the back porch or something, but keep it far away from them. Other things you could do is hide their cigarettes, hide them, hide the lighters, hide your lighters, hide anything that reminds you of smoking. You know, the smell of smoke, almost nicotine can, you know, make you relapse and go back to smoke a cigarette, you know, and just you're changing your environment. That would be that's one of the biggest things, you know, your environment.
Thank you. Deborah, how about you? What were some of the supports that you received when you were trying to quit smoking?
I don't know. I kind of think I kind of did it on my own. I tried different things. I remember doing the patch and doing, I don't remember what else, the gum or whatever. And I just really wanted to quit. I just knew it was so unhealthy.
Okay.
And then talking to other people, and then someone at work said she quit by doing Chantix. And so I went, she had nightmares from it, but she thought, you know, what do? Do you have some nightmares or do you quit smoking? So, you know, she just quit smoking by doing it. And then I just got a prescription for it and did it.
Great, thank you. How about the supports that you received when you were diagnosed with lung cancer? What kind of
Okay, and
support
that
did you
I had
receive?
total support of my family.
Can you
My
talk about that?
husband yeah, my husband was totally crazy. He would go to every, you know, lung doctor, every appointment I had, he would go to. And when I had the operation, he was there as soon as visiting hours started and stayed until he had to leave, you know, and my son was there too. He came after work. So, you know, during that, my family was the support.
Right.
And I had great care. Dr. Khan came to see me and stuff. So it was great.
Wonderful. Now, we have a number of questions that were submitted from the audience. So should we take a few of those at this point? All right. Here is one question. We'll open it up to anyone who'd like to answer. Does marijuana smoking carry the same dangers as cigarette smoking? That's one question that we received from the audience. Dr. Wells or Dr. Pasquinelli?
I think that, so there is, and Dr. Pasquinelli can add to this as well. They impact the body in different ways. And so there may be, I'm not going to say that there's no lung involvement, because anytime you're inhaling something, there's potential for there to be damage to the lungs. But with marijuana, it's probably more of a brain effect.
All right.
Yeah, and I would add to that, we don't believe that marijuana causes a lung cancer, but it is taking chemicals or even just the marijuana into your lungs that can cause inflammation in your lungs. A lot of my patients ask for medical marijuana. If you are a cancer patient, you have a type of illness that is okay to take medical marijuana, but I ask patients to do it in a form of the topicals, the edibles, the gels, the oils, instead of smoking it, just because, you know, patients with lung cancer, it's better not to have anything that influences your lungs. The other thing is, anytime you smoke a cigarette or marijuana, it is a combustible product. So you are taking carbon monoxide into your body. And we know carbon monoxide is an odorless, tasteless, poisonous gas. So just want to add to that.
Mm-hmm. So it's the linkage with lung cancer directly, maybe hasn't been established, but there are a host of other health-related reasons why you might not want to use smoke tobacco. And for those individuals who are using it for medical reasons, or now in Illinois, it's legal recreationally, try to migrate to a non-smoked or non-combustible form of marijuana use. Yeah, thank you for that. Another question is about e-cigarettes. What are the risks and benefits of e-cigarettes? Is it real? Are they really something that can help you stop smoking?
I can answer that one.
Okay.
So, and Dr. Wells, please chime in. E-cigarettes are, first of all, they're not FDA approved. We don't know what is in e-cigarettes. It also is a chemical that we're putting into our lungs, again, causing inflammation. I think only clean, fresh air should be in your lungs and not cotton candy flavored vapor. But the thing is that the e-cigarettes have now been bought by tobacco companies. Tobacco owns the e-cigarette trade, and they really don't care if you do an e-cigarette or a regular cigarette. They just want your money. And it has been shown that they were saying, oh, e-cigarettes will decrease smoking, but actually it is being used to get our youth addicted on nicotine. Nicotine is highly, highly addictive. And there was a randomized control trial helping people who smoke to either use patches or use e-cigarettes to help them. And they did find that after a year, less people were smoking regular cigarettes and the ones who use e-cigarettes versus the patches. But they just transitioned from one type of nicotine delivery device to another. So, and nicotine itself is not good for your body. It's a vasoconstrictant, causes hypertension, it causes a lot of other problems. So the best thing to do is not use any nicotine any nicotine products, if possible. We're using them to wean patients off cigarettes, but it's best. Maybe it's safer, maybe it's not, but I mean, it doesn't have maybe all the other chemicals, but we don't know what else is added into that.
So what was causing all the problems with the teens a few years ago when we had the big news around the lung injuries that was experienced by teens who were using the e-cigarettes? What was causing that?
Dr. Wells, do you want to answer that or you want me to?
You can go ahead because I don't remember the specific details.
Yeah, so there was a lot of different e-cigarettes out on the market. Some that were more done in a better quality manner, but often patient or individuals are getting like cartridges off the black market and filling them up with different kinds of oils and chemicals. And there were some of those oils and chemicals that were put into that was causing major lung damage. So you got to be careful with everything that you put in your body, particularly putting into your lungs. But that was one of the chemicals, I think it was a vitamin E oil that they were putting in to make it kind of a smoother experience of taking it into your lungs. But that was causing a lot of the lung damage. Dr. Matthews, you may even have more information on that.
No, that's a good summary. It was very scary as we see, because the thinking was in the general community is that these are much safer, but they're not. It's not a safer product. And then, like as you're saying, it's for most people it is not an aid to smoking cessation. Most people transfer from one type of nicotine delivery, regular cigarettes, to another. Right. So we just have to be really careful about when we're trying to quit, use evidence-based approaches, right? Then a nicotine replacement in the form of patches or gum, or the stop smoking medication such as Chantix, and counseling. Many people are not aware that there is free counseling as well as nicotine replacement if a person qualifies through the Illinois Tobacco Quit Line. Can anyone speak to the services from the Illinois Tobacco Quit Line?
I used the service twice.
Oh, all right, Jonathan, tell us about that.
Just twice, I think, before I actually started my journey. I think I called the hotline once or twice just to talk to an operator about, I think I wanted to stop smoking, and I had an episode, and I call one of the operators, and they kind of help me through it.
So what happens? It's toll free, right?
It's toll free.
Toll free.
You dial the one. I think it's the 1-800 number. I don't.
Okay.
Don't quote me on that, but it's
Maybe someone will put it in their chat for us.
It's on the Freedom from Smoking. I think it's on the American Lung Association website.
So when they call,
You put the number. You have to wait. I mean, it's not perfect, you know. So you have to wait for operator. But if you're willing to wait for a couple of seconds, somebody will get, you know, talk to you, and they kind of walk you through the steps, kind of like breathe. I think, I can't remember exactly, but I think the operator is telling me just to breathe, and he's telling me to breathe, and I can't remember exactly, but I know that's one of the main things I was doing. I was breathing, I know. So yeah, that got me. But yeah, he talked me down, and actually it was about 15 minutes, and I got through the episode. It's good.
right. Is that something that you would recommend to anyone who was trying to quit or who was having a situation where they thought they might relapse? Is that?
Yeah, I recommend. I highly recommend.
Excellent, wonderful. So another question that was asked was related to advocacy, either being an advocate for tobacco cessation or an advocate for lung cancer screening and early detection. Deborah, can you and Jonathan tell us a little bit about your advocacy and what types of things that you do to try and encourage both those things?
Well, in my talks, when I see people smoking, it always breaks my heart, you know, knowing how difficult it was for me too. And I recommend, you know, the Chantix all the time. And, you know, and speaking at these places, just to reinforce the early detection is just mind-boggling to me when people don't do that, because as Ms. Pasquinelli said, the symptoms don't come until way later. And it's like, you know, your chances of surviving minimizes. So the early detection just makes it so much more likely of a, you know, survival rate and not going through all that cancer stuff.
Okay, right.
Just, you know, thinking about your health, you know, I always tell people think about your health because, you know, it just reduces your hypertension, you know, diabetes, you know, and I just noticed my mom and my dad, they both are diabetics. So I know that, you know, me smoking, I know that it's just inevitable, you know, so that's what putting my health in mind. I always tell people, like, just think about your health long term, you know, and then I show them as well, because a lot of people, they don't believe what you're saying. They gotta show them. So I think just me showing them and doing that works, and just motivating them.
How do you show them?
Well, you know, I have actually like a workout program, like I do. Like you know, things that I do, things that I have done personally, you know, to stop smoking. Like I kind of replace smoking with certain things. Like when I wake up in the morning, I say affirmations. I say my affirmations. I drink a bottle of water. I got a little workout regimen that I do every morning. You know, so that kind of replaces that need, you know, for the nicotine. You know, and after I'm done, you know, it kind of gives me almost like a natural high. You know, I don't know, but that's what it does for me. I don't know, it might work for you, it might work for some different, but that what works for me, you know. So I kind of just, if they like working out, I'm like, hey, well, you could try this. I got this little program, this is what I do. You can try it, it works. And good to go.
Thank you for sharing that. Another form of advocacy is to be involved in research projects, research clinical trials. Dr. Wells, Dr. Pasquinelli, can you talk about clinical trials as a way of advocacy or giving back or helping to inform ways to improve health around smoking and lung cancer?
Yeah, maybe I can say a few basic things and then Dr. Pasquinelli can add to that because I know she has lots of experience in this area. I think the importance of clinical trials is that it helps us to be able to understand, one, the impact of disease. It also helps us to come up with newer therapies and treatments for disease. So I think that it's important that we do these things because it is because of clinical trials that we have had advancements in medicine over time. The other thing that we can say, though, that it's important that all types of people get engaged in clinical trials because what is impactful to me may be different than what's impactful to you. There are a lot of things that impact disease, you know, how we eat, how we live, the environments that we grow up in, our stress levels. There are a lot of different factors that play into that. And so that's why in clinical trials, they need people from all different types of backgrounds so that the therapies and treatments that they come up with are not just related to certain types of people, but they are representative of all different types of people.
Thank you for that. Barry.
Yeah, so the clinical trials is a very important step to further our knowledge related to different cancers or different illnesses. Here at UI Health, we have many clinical trials that we talk to. We have actually a person who screens our clinic to see if any patient is eligible for that trial. And then we talk to the patient about that trial and what's so important to it. The reason why lung cancer, the state of the cancer, the State of the Union report on cancer this year showed a significant decline in cancer, lung cancer related deaths. And that is because of three things: lung cancer screening, smoking cessation, and then also the new treatments. We now have something called immunotherapy that is helping many patients across many different cancers. We wouldn't be able to understand how beneficial this was if it wasn't for patients saying, yes, I am willing to be a part of a clinical trial so you can understand more. And this is often clinical trials is like, oh, I don't want you to do research on me. These are often very well-known medications, but it may be a different combination of medications, such as, for instance, we have a treatment that we give immunotherapy a couple doses before lung cancer surgery, because we know that maybe that will increase survival yet either also. So, but we won't know unless we actually look at the study. So our patients are incredibly important to us, and the research is important for everybody with cancer.
Now, yesterday at another meeting, I heard you talk about biomarker testing. What is that?
So what is interesting in many different cancers, but particularly lung cancers, is what is driving one person's lung cancer may not be the same thing that is driving another person's lung cancer. So let's say all of us have a non-small cell adenocarcinoma. We know that we now test the tissue. We take a piece of the tissue from the biopsy and we send it to a company, and they look at over 600 different genes or molecular changes. And they can see if this is a cancer that is being driven by a certain mutation. And if it is, we have about 12 what we call actionable mutations, where if that patient has that mutation, the therapy is not chemotherapy, but it's a pill. It's called a tyrosine inhibitor. So it is very, very, very important that all patients with lung cancer get a biomarker testing done. And when they do, we can find out what mutation they have. And if they have that, we can start them on the right therapy at the right time. So, and we also even have a mutation that that is more common in people who have smoked than not smoked. And so we now have a pill for that too, if they meet eligibility criteria. So understanding the biomarker or the molecular structure of everybody's individual cancer helps us to do the right treatment at the right time.
Oh, thank you so much for that valuable information, all of you. So we're very close to time, and there are just a few take-home points that I've heard shared today that I just want to underscore. The first, try to quit smoking. It's doable. Jonathan is here to attest to that. Deborah is here to attest to that. By utilizing evidence-based treatments, you can break the addiction with nicotine. The second, if you have a history of smoking, there's a life-saving early detection modality, low-dose CT lung cancer screening, that is painless, that is covered by insurances, and that has the ability to detect, just like with Deborah, lung cancers at a very early stage so that they're much more treatable and increases the likelihood that you're able to live from and go on to live a very healthy life afterwards. The next is if you're trying to make a change in your behavior, look for support. And if you're impacted by cancer, look for support. We all need support as we're going through very difficult life transitions. And the final thing is, don't be afraid. Don't be afraid. Again, these treatments for smoking, for screening are evidence-based. They are life-saving. And if you have questions or concerns, talk to your provider, and making sure that all of us have access to the most helpful and innovative and cutting-edge treatments. So if you're eligible to participate in a clinical trial, please do. So I want to thank you all, to our panelists, a special round of applause to all the great information and your willingness to share your experiences and stories. And thank you all to the participants. We look forward to having another community engagement opportunity with you in the near future. So at that point, goodbye, thank you, and enjoy the rest of your day. Once again, thank you, panelists. Excellent job. Bye-bye.
Thank you.
Bye-bye.
Thank you, bye.